Welcome to this next edition of the Beyond the Blade podcast. I'm Dr. Zuri from Zuri Plastic Surgery, and we're here with two of my nurses, Jazmin and Alessandra, and they are both fantastic nurses that have been with me for a long time, and so we're bringing them on the podcast to really help us dive deeper into a lot of the topics that our patients have, and so we're going to be elaborating on those. So I'm going to open up the floor to both of them, and they have a series of questions that we're just going to kind of go over and try to answer. So who wants to start?
I'll start. Basically, when patients talk about their experiences after surgery, we like to get a lot of feedback, and so we like to ask patients, like, what would you have wanted to know more about, or what was the most surprising thing about recovery? And I think the top thing that Ali and I have noticed is that patients are the most surprised about swelling. Swelling is super common after surgery. It can last for 6 months up to a year. We consider your results to be final after a year, but I think that we're always, expecting every week to get easier, swelling to be resolved. Let's say you had a tummy tuck, you expect those results to be perfect by like 2 weeks. You're already looking exactly how you're meant to look, but it takes a lot more time than that. Some days can be good. We describe it like a roller coaster, where there are some weeks that you're maybe looking really flat, and then other weeks that you're maybe going back to work, or that you're going back into a regular routine and the swelling is kind of coming back. But that's normal. It will resolve with time. But patience is very important when it comes to your procedure and having those realistic expectations. So I think we're working on emphasizing how much swelling will be pretty evident with your recovery, but that's probably the thing that I hear patients the most surprised about.
Right. How about you, Ali?
Yeah, agreed. Definitely swelling is a big topic. We get patients that unfortunately get a little bit discouraged because they expect their swelling to be completely resolved maybe within the first month. It is a lengthy process, so you're definitely getting into a commitment, but I think you have to stay positive, and every day you do get better and you do recover day by day, but you just have to have that positive mindset and understand that it is a definite long process.
Yes, and so that's where we tie in a lot of the modalities that you can use in your post-op course, and one of those, and a common question, is hyperbaric oxygen. So hyperbaric oxygen is fantastic when it comes to increasing the oxygenation of the tissue, increasing the blood oxygen levels. It's very safe. You are not going to be placed in this chamber that's like sealed and like for a scuba diver who got the bends. This is more of a softer version of hyperbaric oxygen that is readily accessible, easy to get in and out of the device. We actually will be offering this in the future, and this is coming soon for spring 2024 to our practice. And we also are going to be offering a lot of other modalities. A lot of patients ask us about massage therapy. How often should they get massages done? What type of massages? They ask us about IV therapy. What are the benefits of IV micronutrient replacement, pre-surgery, post-surgery? So these are all items that are very important in your recovery. If you want to help reduce your swelling, you want to get at least around 15 to 20 massages after your surgery. And I think a lot of patients are surprised when myself and my staff talk about how many massages you really need to really start to reap the benefits. And just like Jazmin said, this is a multi-month process, all the way up to 12, 13, 14 months sometimes, depending on the type of surgery, also depending on the age of the patient, how much surgery was done at one single time, at one single event. A lot of our patients say, well, I want to do as much surgery as I can in one procedure. Well, then you have to really understand how much swelling you're going to have and how long you're going to be swollen for, because the more you do in one day, obviously the more inflammation and the more swelling and the longer it's going to take to get better. So yeah, jumping into hyperbaric oxygen, if you're doing 3 to 4 sessions a week, post-surgery for about a month, that would be fantastic to help you with that. Also, hydration after surgery with the IV fluids would be great. And even having an IV fluid, a liter of IV fluids the night before your surgery to optimize you for the morning of surgery would also be fantastic for a lot of our patients to consider. And we also will be offering full massage services in spring of 2024. And the kind of massage you want to get is a manual lymphatic drainage, okay? We always emphasize manual because that means that an actual person is doing the massage. Now, there are some great technologies that are coming out now, and we're at the forefront of that using a system called Balancer Pro. And I encourage everybody who listens to the podcast, go onto their website. It's fantastic, not just if you're having surgery, but just for general recovery. Let's say you're an athlete or you're a weekend warrior and you're exercising a lot. This will help improve your lymphatic flow, and it'll decrease inflammation, improving your overall recovery. So do you have another question?
I think a lot of patients ask us, like, should you get a massage on your abdomen if you're doing a tummy tuck? And basically your thoughts on why you think that massages are so great. And patients, again, they typically don't think you should massage like a tummy tuck, let's say. What are your thoughts on that?
Yeah, so the tummy tuck is critically important to massage. We took a lot of data and information from South America, from the surgeons in Venezuela, in Colombia, in Mexico, Brazil especially. Brazil is a great resource for us as American surgeons. They've been at the forefront of cosmetic surgery for a long time. And so Miami is bridging the gap between the rest of the United States and Latin America. So in Miami, we, and I specifically, recommend massages to all of my patients. I find that it helps them in many ways. It's not only helping to reduce their swelling, it's also helping to smooth the tissue. So when the tummy tuck is healing or when the lipo is healing, it's giving them the flattest, the smoothest results. Also, there's an emotional and anti-anxiety component to the massage. They feel better. They're more relaxed. A lot of the patients tell me, wow, like I was only supposed to get 15, but I'm on number 30 of my massage because it makes me feel great. I just feel better. I feel happier. And so that is the value of massage in general. So yeah, great question. And I think that for almost all of the surgeries that we do, except for breast augmentation or breast lift surgery, we don't recommend massages for those, but pretty much everything else that we do would benefit from massage. Yeah. All right. So Ali, do you have another question from that list or you want to bring up?
I think talking about our favorite add-ons, we definitely like to emphasize those. So what's your take?
Yeah, so the add-ons are 4 different add-ons that we highly recommend just to improve your overall experience, to improve your recovery, and to decrease complications. So I've tried to do a podcast on each one of these add-ons, and that is the pain package with Exparel, that is Prevena that we spoke about regarding incision dressing and vacuum dressings to improve healing. We've also touched upon in the past the use of Artis, which is a fantastic product to help glue the tissues together when we do tummy tucks, when we do facelifts, arm lifts, breast lifts. And also one that we want to dive into deeper later on in a separate podcast is Aesthetisure. And Aesthetisure is very important to discuss because it is they're one of the only 2 companies in the entire United States that offers cosmetic surgery insurance. And so if you're thinking about having cosmetic surgery anywhere within the United States, they will cover you if you have any complication related to your surgery for the first 6 weeks after the procedure. So this is revolutionary. That didn't exist in the past, and it's really helped patients who may have even just a minor complication or a minor worry, and they end up in the emergency room with a very large bill that, by the way, their primary insurance will not cover the cost of that ER visit or hospitalization because it's cosmetic surgery, so they will deny you the claim. So please remember that. If you're having cosmetic surgery, you always want to prepare yourself in case of any complication, and Aesthetisure is at the forefront of that, and that is something that we offer at Zuri Plastic Surgery. So I think we're going to wrap up this question session with our nurses, and we want to thank you for listening to the Beyond the Blade podcast, and we hope to help answer future questions.